I'm Jill Campbell, I'm Chair of ONI. ONI is the main negotiating body in Northern Ireland. It represents the interests of all optometrists, dispensing opticians and optometry practices in Northern Ireland. And our goal is to achieve sustainable eye care for the population of Northern Ireland. Our main goal is to raise the public perception of optometry as a healthcare profession. I think during COVID, we really did elevate our position in terms of being accessible to the public. And we really want to make optometry as the first port of call for all eye care needs. And we want to do that by raising the profile of the existing scheme we have, NI Pairs, and by the introduction of this IP scheme. We also want to be able to make sure that to deliver all of those things, we've engaged with the profession and that the profession want those to be delivered in primary care and that they have the ability to access the additional qualifications that they need to be able to deliver those services. And so I think part of ONI's role is really a supportive role. I just think practitioners feel probably a little bit like they're lurched from one crisis to another, that every time they feel like they've got their feet in an even keel, something else is upending them. Part of it is to be there, to be that sounding board. Lots of our practitioners do really work in isolation. And I think it's the lovely thing about having a committee that represents everyone's interests, that you do have someone to talk to and you do have someone that will represent your interests, particularly if you're a sole practitioner.
What would you say is the biggest issue for optometry in Northern Ireland?
I think the biggest challenge for optometry in Northern Ireland right now is probably no different than it is for the rest of the general population. I think it's the cost of living crisis. I think it's the concern around practice sustainability and can practices afford to pay their bills? I think that's what's on the mind of most practitioners at the moment. And we also have in Northern Ireland that's compounded by the fact that we have real political uncertainty. Right now, we don't have an established government. And that's a real problem for us in Northern Ireland. Fortunately, we do work very closely with the Department of Health colleagues, and they're led by Raymond Curran. And they're really supportive in listening to our concerns. We had a meeting with them just this week. And I think that's really encouraging for us that we do work very closely with them. We're lucky we're a small region. We know our colleagues well. And hopefully we will be able to put things in place that will reassure practitioners.
What would you say is the biggest success for optometry in Northern Ireland during the pandemic?
We were a very united profession. Optometry can often be a little bit disparate, but we came together and we worked incredibly well together. In community practices, we buddied up, we delivered IP care across communities, we delivered really excellent patient care. And through that, we developed very good interprofessional relationships. And we built really good relationships with GPs, with ophthalmology and with pharmacy that we just didn't have in place before. Initially, it was managing the uncertainty in the workforce, and there was a huge amount of fear around the sustainability of practice before we had financial support systems in place. Then initially delivering emergency care, being the only place that was open on the high street, was quite daunting for practitioners, delivering face-to-face care in a really uncertain environment. And when practitioners felt that they're most vulnerable, but it definitely did enhance practitioner confidence. And it really did, as we've talked about earlier, elevate the profession and elevated the profession with ophthalmology. And it did show the full scope of our practice. We did have most of our practitioners during that time when we had emergency care. And I know I was working in practice at that time. We were all working right at the top end of our scope of practice. We were all managing things that we hadn't managed in practice before. And I think that did cause quite a bit of uncertainty in practices, but it also united us as a profession, and we worked much more closely together, particularly with our IP optoms, who we did very much rely on. Eye Casualty really did see the value of optometry and the value of IP optometrists, and COVID did give us the opportunity to show the capability that does exist in primary care.